All right, guys, so we are going over hip flexor pain today on this video. We're going to go over some certain things that people complain of, certain movements that hurt it, why it might be hurting it, so causes of it, and things to try at the end of the video that could possibly give you some relief, and then steps to take going forward from there if that does work for you, okay? So stick around or fast forward to whatever you're looking for as far as this video. But we're going to start with just the hip flexor. I'm going to show you exactly what we're talking about. So on me, hip flexor itself is located right here in the front, okay? So as I push right here, you'll feel this muscle, and a lot of times people complain of pain in this specific area, okay? So I'm going to show you what that looks like on this skeleton model here. This green band is going to represent that muscle. So the hip flexor itself is also known as the psoas muscle. So the psoas muscle attaches from the lumbar vertebra here, so the last few lumbar vertebra here, and it comes down and attaches at the top of the hip, right where I pointed at the beginning of this, okay? And so the action of it when it shortens is it's responsible for flexing the hip or bringing the knee up towards the chest. So a lot of times what people complain of with this specific issue is I have a pinchy feeling type of pain in that specific area. I have a lot of achiness or tightness in there. And so people are told that they have a hip flexor strain itself. They are told that they need to stretch it or strengthen it or things of that sort. And a lot of things that you're trying, maybe stretching that specific area over and over again, could give you temporary relief, but it doesn't last. And why? Or strengthening that area, maybe strengthening it is just causing more and more achiness and stiffness in that area, and you're not sure why that's going on. So I'm going to go over a little bit of the anatomy, certain things that can cause pain in that specific area, and then we're going to get into some exercises that might help you, okay? So when we talk about this specific area, one thing I want to focus on is a couple of structures in the low back here, okay? So if we look at the vertebra here, this is your low back vertebra, okay? And in between, you'll see these little, in here it looks kind of clear compared to the white. These are your discs in your low back, okay? And the discs, the way the anatomy works is we like to compare them to jelly donuts. So in the middle of this disc here, in the very center of the spine, is the nucleus of that disc. And it moves around based off of your movements. So flexion of the spine, so rounding, bending forward, twisting and moving, things of that sort, sitting in postures like this, squatting, things like that, can drive that jelly material towards the back. And at the very outer edge of this disc, it causes pain, okay? And sometimes that pain can refer to different areas around. And so a lot of times people complaining of hip flexor pain here or here on our little skeleton model here is referred pain from that area, okay? So that's one thing that can cause hip flexor pain. Second thing that can cause hip flexor pain is the nerves. So if we look again, another structure in this low back, you have these spinal nerves that come out right here, okay? And those themselves come out of the low back and supply areas of the front of the hip, the side of the hip, down the back of the leg, down the front of the leg. And so when those get irritated based off of one, the disc, again, can press on that nerve, or two, maybe some bony changes in this whole area where the nerve is coming out. That can compress on that nerve, and the nerve refers pain to this area as well. So that's another cause that can cause pain in the hip flexor there. So what's the cause of that tightness? Well, if we don't look here at the low back, then maybe we're missing something as far as that pain that we're feeling here. Oh, well, I've been told that, I got an MRI on my back here and there's nothing going on and it's my hip flexor and that's what's causing it. Okay, so a lot of times the hip flexor itself, maybe you're told that it's overused and you need to work on other areas. So I'm going to stand up and show you something people are told is lower cross syndrome. So lower cross syndrome looks like this. So if I'm standing up straight and then I dump into my low back like this, I'm very roundy here. So these are tightened, my glutes are turned off, my hip flexors are tightened, my core is turned off, okay? So maybe we need to focus then on, instead of strengthening here or stretching here, maybe let's go to the muscles that are underused, like the core and the glutes, to take the tension off of the hips here and get these to be doing more of the work, okay? So those are some of the things that could be causing hip flexor pain. People complain of pain while sitting, squatting. I can't even remember some other things that they cause, but those are the main things that people complain of, okay? And so we're going to, I want you guys right now to get up while you're watching this video, and I'm going to have you pick a provocative movement. What I mean by that is every time I do this specific movement, it causes my hip flexor pain, okay? And so I'm gonna get up and I'm gonna choose the squat, because the squat is the one thing that a lot of people with hip flexor pain complain of. So I'm going to stand here, I'm going to squat down without hitting my butt on that. Squat, okay, I'm taking a baseline level of what that feels like right now. And we're gonna try a few different things, and we're gonna come back and retest this. So make sure you take your baseline level so we can see which one works best for you. We're gonna go through a library of exercises, okay? I'm gonna pick maybe 4 specific things that you guys can try at home, okay? So baseline level, how does my hip flexor feel? Let's try this now, okay? So I'm gonna get down on the ground, and I'm gonna prop myself up onto my elbows like this, okay? So we're gonna go through taking into consideration all those structures that I talked about in the beginning of the video. So this one here, if it's a disc issue that's causing that hip flexor pain, then this might help for you, okay? We're going to take our hands and we're going to press up and come right back down. We're not gonna hang out at the top for a long period of time. We're just going to do reps of this, relaxing the low back muscles, relaxing the glute muscles, and really only using my arm strength to press up into this position. Come as far as you can, whatever feels comfortable, but try 20 to 30 reps of those, okay? Do that at home right now. And once you've done 20 to 30, maybe pause the video so you can do it really quick, okay? And then come back and retest. Now I'm gonna pick my squat, whatever your provocative movement was, retest and see how it feels. I always say we're not looking for perfect, we're looking for progress, okay? So 30% improvement in that short amount of time of doing that many reps is huge, okay? So if that one worked for you, what do you do now? Well, let's just do more of them. We'll talk about what to do later on in the video, but for right now, if that worked for you, do more of them and see how much more improvement you can get with that one, okay? If that one did not work for you, let's try something different, okay? So also just take into consideration, we have not done an exam on you. I cannot tell you what exactly is causing your pain, but if that extension one worked for you, then the stuff that we're gonna recommend later on is gonna be really beneficial for you, okay? Next thing we're gonna try is maybe if it's nerve related. Remember the spinal nerves coming out that supply this area? Let's see if we can calm those down for a second and retest our movement. So most people are very familiar with the child's pose position. So I'm gonna go into tabletop position here on my hands and knees. And especially with hip flexor pain, a lot of times going into this kind of squatting movement hurts it. So just bring your knees out a little wider. Bring your feet closer together and sit the butt back. That allows for more room in the hips here. I'm gonna come down and I'm going to relax my head in my hands here. I got really close to the microphone, so the video probably got really loud, but we're gonna hold in this position for a little bit, okay? You see a little bit of rounding in my low back here. This should not be a painful position for you. What you're looking for is really no pain or discomfort at all. It shouldn't feel like anything. So what you're gonna do is hold this for a minute. Pause the video, get into this position, and hold for a minute, just like this. Okay? Breathe into the pockets. Once you've reached a minute, get up, retest your movements, okay? So I'm retesting my squat now and seeing how it feels. Again, not looking for perfect, looking for progress. Wow, that worked out really well for me. What do? Use it more, okay? Use it throughout the day. See if you can chill the hip down a little bit. And if that one really worked for you, maybe we should still, again, not look at the hip flexor itself, but look at the low back to see if that's what's causing that pain, okay? Another thing I'm gonna try now is sometimes what can cause pain here is pinching or hip impingement, okay? So I'm going to go into this lunging position here, okay? And I'm going to then just lean. Okay, it looks like the hip flexor stretch that maybe a lot of you have tried. But what I'm gonna do is make sure, one, I'm squeezing this butt cheek, okay? So I'm not getting really extendy here, but I'm squeezing this butt cheek and just leaning forward, get that stretch, and come back. Forward and back, forward and back. Okay, we're gonna rep through this, keeping this butt cheek squeezed the entire time. Try 20 to 30 of those for that side that is causing pain for you, okay? So I'm just gonna do these a few more times, looking at my form. See, I'm not moving my low back at all. I'm keeping my booty squeezed, getting a little bit of a stretch here, coming right back out of it. Come to the point of discomfort and then back out. 20 to 30 reps, you guys, okay? So pause the video, try that many reps. When you're ready, try your provocative movement again, all right? Again, not perfect, but progress. 30% improvement. Wow, that feels a lot better. That is the first aid movement for you, okay? Use that a little bit more if that worked for you. We're gonna try one more thing, okay? So I'm not saying that everybody should try all 4 of these things. I'm saying pick the one that works best for you, use that one, okay? Show you guys one more thing that you can try for your hip flexor pain. So we're gonna get down on the floor here, and I'm going to say, look through the tunnel. What does look through the tunnel mean? It means look through the space in between my knees from this position. So I'm gonna look like this. Boom, okay? There's 3 different cues I'm gonna take you through. 1, push through the forearms. 2, squeeze the butt cheeks. 3, bring the elbows and knees closer together without actually moving. This is what that looks like, okay? Look through the tunnel, push through the forearms, squeeze the butt cheeks, okay? Bring the knees and elbows closer together and hold and breathe. I'm shaking like crazy right now. That means I know I'm doing it correctly. This is turning the belly wall on, okay? So we talked about belly playing a role in maybe overusing your hip flexor and not using the belly wall a little bit more. So hold that one for as long as you can. Pause the video, try it out. Do it to fatigue till you can't anymore. You should only feel it in the front belly. Retest your provocative movement, okay? Again, I'm gonna repeat one more time. Not looking for perfect, looking for progress. I'm out of breath. If you got 30% improvement with any one of those exercises, and again, I said 1, not all 4, pick 1, use it for a little while. But where do we go from here, okay? Do I have to do that forever for the rest of my life to keep myself out of pain? No, that's just a start. We call it a first aid. That's step number 1, okay? Chilling the body down, getting you to use something that maybe you can get back into that provocative movement again, and seeing if it works for you. All right, guys, so where do we go from here? Once you find that first aid that works for you, again, we just dose that out for a little while and calm the body down. For those of you who maybe think they need a little bit more guidance, hey, I actually want to know what else should we do? I want some videos and things to try at home. We have that as well. That is an option for you as well. Something that you can purchase and follow at home. Click on a link, follow these exercises, do this. If the first aid stuff that we did for you today worked, this is the next step, follow those, and that's something that you can do from home. You can find that in the description below as well. If you don't want a custom program, you want something a little bit more individualized for you, this has been going on for a really long time, you've seen a lot of people and it's not getting better, then we have that option as well. We can hop on a virtual chat and chat a little bit more. You can come see us in person, but all of that is an option as well. We can individualize it. We can brainstorm together. We could talk about goals and symptoms and go forward from here. So guys, we have tons of options from free to paid, whatever you want in between, but you just have to reach out, let us know, or click on the links that I just mentioned and go from there. So we'd love to chat with you and love to help guide you through this.